Okay. My name is Jay Yamahata, and I'm a chiropractor, registered chiropractor in Japan, um, and also a diplomat in osteopathy, registered in Canada. Okay. And in this course, we're gonna focus on chiropractic principles, techniques, evaluations, and everything that is necessary for a chiropractor to know. Okay. So in Asian country, especially India, there's a lot of fake chiropractors, and they are actually ignoring the principles of chiropractic and doing thrust techniques that they're not supposed to do. Okay. So as a registered, if I post those kind of dangerous adjustments on YouTube or Facebook, any kind of social media, I can be banned from the registration. Okay, so for all of you that are joining this course, I want you to know that after graduating our course, you will be real chiropractor, not a fake chiropractor, and I'm ready to teach you everything I have. Okay. So the previous master's course and the diplomat course in chiropractic was a great success. Okay. A lot of people have joined and they have completed the whole program and the passed the um, registration exam for the diploma in chiropractic science. Okay. And I am very proud of them because they have changed in this 3-4 years. Before joining our course, they were doing all sorts of cracking techniques that I don't really call chiropractic. Okay. It's just a chiropractic technique that physiotherapists do, but that's not a chiropractic science. Okay. So in this course, we're going to focus on the real chiropractic that is a standardization in the international manner. Okay. So to be a chiropractor, you have to know the principles and especially know where to adjust, why you're going to adjust, and also where not to be adjusted. Okay. It's not about posture. Okay. Everybody thinks that chiropractic is just cracking the bone to fix the posture or treat the symptoms. Okay. And chiropractic principles, we're not actually treating the symptoms or we're not treating the diseases itself. We're going to treat the patient as a human being. We're going to see the structure that is disturbing the functions. Okay. If the functions are disturbed, the patient won't be able to self-heal. Okay. So we're not like if the patient has cancer, we're not going to treat the cancer. We're going to treat the body and find the major subluxation that is responsible for um, disturbing the functions. If the functions are restored, any human beings has the ability to heal itself. Okay. And that is the principle that BJ Palmer, the son of the founder of chiropractic, D.D. Palmer, his name is BJ Palmer, made these principles of chiropractic. Okay. And in his principles, it doesn't say fixing the posture at all. Okay. He doesn't say cracking bones. Okay. It's about restoring the this functions. Okay. And we call it innate intelligence. Okay. Okay, let's go to the slides. Okay. Okay. So in this course, Master of Chiropractic Science certification program, we're going to focus on chiropractic science, not chiropractic techniques. Okay. And in this chiropractic science, we're going to focus on many techniques as well, evaluation techniques and adjustment techniques. And there are two types of chiropractic. One is national and the other is Palmer. Okay. In our first part, in the early stage, we're going to learn the diversified techniques based on Palmer, BJ Palmer techniques, but it is different from Palmer techniques. Okay. So part one, we're going to focus on the facet joint dysfunctions, subluxations. Okay. That is diversified techniques founded by BJ Palmer. Okay. And also we're going to do post isometric relaxation technique, or that MET in osteopathy, but in chiropractic college, we learn it as PIR. Okay. That is relaxing the tight muscles that is responsible for the subluxations. We're going to find the subluxation and we're going to treat this tight muscles using the Golgi tendon. Okay. Okay, so we're going to stretch the short specific muscle and have the patient to resist against the stretch, and that is called post isometric relaxation techniques. As the patient resists against the stretch, the Golgi tendon will stretch more, and the 1A spinal cells will get short. That will release the activated gamma alpha neurons. Okay, so it's a treatment stretch. Okay, for relaxation purpose, everybody does stretching, but that is not good, because if you try to stretch passively, both 1B and 1A will be stretched. And if the 1A, the spinal cell stretches, uh, alpha neuron will activate and try to contract. Okay. That's the stretch reflex. Okay. And that is one of the causes of secondary subluxations. Another technique we're going to focus on is the positional release technique. Okay. It's an indirect technique. In osteopathy, we call it strain counter strain, and there are also facilitated positional release and LAS. LAS is ligamentous articulation strain. Okay. This technique is in chiropractic college, we learn it as PRT technique. Okay. Positional release therapy techniques. Okay. So this is a post isometric relaxation technique, and post positional release therapy is chiropractic techniques, not osteopathy. Okay. So you have to learn this in chiropractic school in order to be a chiropractor. Without learning these, you're not a chiropractor. Okay. And in part two, we're going to focus more into the Palmer techniques. We call it specific chiropractic, or straight chiropractic. And this is mostly focused on the disc degeneration instead of the facet joint dysfunction. The most famous Palmer technique will be Gonstead technique. Okay, call that full spine techniques. Okay, you're going to see this body as a whole and find the posterior slipped spine segment, and we're going to push it P to A as we torque the open wedge, the closing the open wedge. Okay, but that is different from national chiropractic. Diversified technique is opening the closed facet joints. Okay. And Palmer technique is closing the open wedge instead of opening the closed side. Okay. And pushing the disc, the spine back onto the disc. Okay. This is very specific. You need to know the X-ray analysis very well. Okay. And we're gonna spend a lot of time in these X-ray analysis, constant X-ray analysis in this course. Also, we're going to do the Thompson technique. That is a drop table techniques using a Thompson drop table. In this, we are focusing on the short leg length evaluation. And we're going to have see which spine to adjust, which way to adjust, and which way not to adjust using the Deerfield negative and Deerfield positive test. This is a leg length test that Clay Thompson developed based on B.J. Palmer's toggle recoil techniques. Okay. Also, we're going to do the toggle recoil techniques that B.J. Palmer developed. It's a specific toggle recoil adjustment. Okay. And also, we're going to do some activator techniques. This is a very good specific and accurate evaluation technique and adjusting technique using the activator tool. You can also use a CAT instead of using an activator. And you will know the difference between the original activator and the CAT. Okay. I'll show you in this introduction course. Okay. So after that, we can do some Cox spinal deep compression techniques using manual techniques instead of using a Cox table, because many people have trouble purchasing a Cox table. Okay. I don't have a Cox table because I rather do it manually instead of using a expensive Cox table. Okay. This hand is much more specific. I'll show you the difference between tools and manual adjustments. How you can control your hand 100%, and activators or Cox tables cannot be controlled 100%. Okay. And also, we're gonna do advanced technique called applied kinesiology technique, especially for the pelvic. We're going to use a pelvic block and cranial manipulation using applied kinesiology muscle testing. Okay. So these are the main syllabus that we will be focusing on. These are the techniques that we're going to practice. Okay. There's many more that we can talk about during the course, but this is the major syllabuses. Okay. 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 So before, if you're going to join this course, you should get ready to purchase some tools. You could get them very cheap in India rather than Japan, because in Japan the Japanese yen is very weak compared to the US dollars. Okay, weaker than Indian rupees. Okay, I think it's the weakest money in the world right now. Okay. Okay, so the tools that we will be using is actually, well, this is the drop table. Okay. So this is a manual drop table. Pick this up and do this. Okay. Or this is the lumbar piece. This is the pelvic piece. This is the thoracic. Okay. And this is the cervical drop. I have 1, 2, 3, 4 drops. Some does not have the cervical drops. In that case, we can purchase a cervical drop piece very cheap in India. Okay. It's supposed to have 2 face piece on it, but it wasn't good for me to use because I use upper cervical toggle recoil techniques. I use these instead to put the C1 here and the head ear here, so the C2 will be stable in a side posture. Okay, so I could do a drop, okay, or I could do a recoil. Okay. So these drop and portable drop is very useful for extremities. Okay. So and practicing recoil, like recoil or adjustments. Okay. This is very you can get it very cheap in India. About 1/3 of the price you can get in Japan. Okay. And also this is the original activator 4. So this is a very specific adjustment tool. And this is CAT CAT EX. So this is another tool that you can use. Not as good as an activator because I'll show you the difference. Okay. Maybe some of you are already friends on Facebook, but I posted this on Facebook for to show you specific a chiropractor must be to treat any kind of subluxations. So this is the Japanese toy. Okay. It's called Daruma Otoshi. Okay. So it's a ancient Japanese toy to play with. Okay. So you actually let's say there's a subluxation here, it's misaligned, this one spine. They want to bring this back into this alignment because the nerves is coming out from here. Okay. To this nerve disturbance is coming from this posterior slip of one segment, not the whole spine. Okay. One segment. And I want to put this back into space using a thrust or recoil like this. Okay. So like this. I can control it with this. All the fake chiropractor are not specific and they're adjusting too much without stopping. So they're actually doing this. Okay. Okay. So you have to be specific enough to evaluate how much width you want to adjust this to take the pressure off the nerves like this. Okay. So if it's too hard and if it's too fast, it won't go like this. It will go like this. Okay. So you have to control it. Okay. And so this is the face. Okay. A mean face. So we're going to adjust it from P to A. We're going to find this one segment with a very specific evaluation using palpation skills. And also you can see it in a X-ray analysis. Okay. X-ray analysis, you can't feel how hard it is. Okay. You can see how it is what misaligned, but you don't know how hard it is and the depth of it. Okay. So yeah, you need palpation skills to specifically find this one segment. Like you're going like this. So it'll be stuck here, going down again. So this one spine here is posterior slip. So you're gonna bring it back into space like this. So the whole nerves will correspond. Okay. Using these tools, and this is make this very, you can make it hard or soft. Okay. This is not okay. So I'm gonna make it one ring that is very weak. Okay. This is one ring is for C1. Okay, one ring. There's up to 5 rings. Okay, so one ring is the most specific and weakest. And like I said, I can control my hand 100% with my hand like this. Okay, they say that activator is specific, but this is the weakest. Okay, what's going to happen? Too strong. You can't control it. Okay, you can't control the width of it. Okay, so that was the weakest. And with that, this activator, this tool, the difference is with the original activator, this can adjust without compressing. Okay. Okay. So you don't know how hard it is by compressing. Okay. So you don't know how hard and the width of it. So as you adjust it, okay, you don't know how hard you should thrust it. Okay? But in this activator, original activator, you have to compress this spring to adjust. So with this, I can just contact without any pressure and this will spin. Okay. But an activator doesn't do anything unless you compress all the way until the restricted barrier. Okay. So like I do this, nothing's going to happen. Okay. Nothing's going to happen unless you compress until you feel the restrict barrier is going to move. Okay. You're going to compress until you feel the restrict barrier. Okay. So using like if it's a P, you're doing using drop table, and you don't know how hard it is to drop this piece. Okay, like make this weak. You don't know how hard. So if you're using this, you don't, it's not doing it. Okay, but if you use this, you need pressure for this activated vator to move. So you know the width. Okay, so but still, you can't control it 100%. Okay, can't control it. It might drop before. Okay, but with your hand, you can feel the width and the stiffness, how hard it is in the width of it. So it will be 100%. Okay. And this drop should stop immediately. It should not go beyond the barrier. So if you go beyond the barrier, you're going to crush the thing below it. Like if you thrust too much, it's going to crush the things below it. So you have to know how hard or how speed and the width of the adjustment, okay, without crushing it. Okay, this is not good, but okay. So these are the tools that you should purchase before well, or as you're learning, okay, chiropractic. Okay, now let's go to the slides again, just a minute. Okay, This is D.D. Palmer. He's the father of chiropractic. And B.J. Palmer. This is B.J. Palmer, the son of D.D. Palmer. Okay. The founder of chiropractic, Daniel David Palmer, opened the very first school of chiropractic called Palmer College of Chiropractic in Iowa, okay, in Davenport, in the year 1897. He was not a physician. He was more like a healer, okay, and he founded chiropractic because um, he tried to fix his janitor that suddenly become deaf after um, he was trying to lift something, and some kind of crack sound when he lifted something occurred in his back. And D.D. Palmer asked the janitor to lay down and see where it hurts and where the pop sound made. And he saw one spinous process sticking out posteriorly. And he didn't know what to do, but he just pushed it in and made a specific crack sound. And suddenly the janitor was able to hear. Okay. And that was the first adjustment that D.D. Palmer did. And he studied a lot about the spine and anatomy, physiology, pathology, and everything. Some says he went to A.T. Steele's college, but it's not for sure. Okay. So Gonstead method is Clarence Gonstead is a son of D.D. Palmer, and he developed the disc degeneration adjustment instead of the facet joint adjustments. Okay, and he fixed a lot of patients, especially people with some kind of influenza type disease people. Many of the patients that received adjustment from Gonstead didn't die, but more than the number of people that had died in the World War had died because of this flu. And those people didn't get any treatment from Gonstead, but the patients of Gonstead, none of them has got severe enough to get dead. That is because of the philosophy of B.J. Palmer that Gonstead practiced, that a subluxation is responsible for the function that is disturbing the functions to self-heal. If the structure is normal, the function will be normal as well. And if the function is not well, that will disturb every organs or every cells in the body, and it will not be able to self-heal. Okay. But if the spine is 100% flowing with nerves or energy, everybody has the ability to heal any kind of diseases. Okay, so that is the method called Gonstead method. You can see Gonstead method on YouTube. American, USA, or Australian Gonstead doctors are very good. Okay. Some Gonstead doctors are not doing it properly. The people that are YouTuber type Gonstead are not actually Gonstead. They learn Gonstead maybe, but actually what they're doing is crackle-maniacs. Okay. Okay, those people are very famous because they crack. Okay, they're not famous because they can treat. Okay, so I don't want you to be one of those crackle-maniacs. Okay, I want all of you to become a real chiropractor to treat and help patients to self-heal. And the other technique is diversified technique. This is focused on facet joint dysfunction. And the same concept as Palmer. Okay. And Thompson technique is the drop table techniques. Activator I talked about, and we're going to do some of SOT. We cannot say SOT because it's a patented. So they can sue us if we use the word SOT without their permissions. Well, it's a pelvic block technique. I didn't show you. I'll show you later. You have to have those blocked to use SOT techniques. And it's very effective as well. Similar to osteopathic manipulation. And toggle recoil techniques. Okay, this is BJ Palmer's special. This is my special too. A lot of people on YouTube try to do toggle recoil, but they're not doing it correctly. You can see in a glance if there are real chiropractor or not. The way they recoil, their chiropractic hand is not what trained chiropractic hand. You can see in a glance if they're fake or not. Even they say they're a chiropractor. In a glance, I can tell. Okay. So after you finish this course, all your hands will be our chiropractic hands. In a glance, we can tell that you're educated chiropractor just by your hands, okay? Or your stance. Okay? It is very important. So this is a vertebral subluxation complex that we're discussing about. So we're going to find one segment that is disturbing the nerves coming in and out of the spine. Okay. So we're not correcting the whole spine. We're going to find the one subluxation that is slipping posteriorly and jamming these nerves. Okay. Usually this is posterior slipped or extended. Okay. If it is extended or posterior slipped, this IVF will be closed. Okay. If it is flexed or anterior slip, this is 100% open, so we're not going to adjust any anterior thoracics or any flexion dysfunctions. Only segment is a single segment dysfunction that is slipping posteriorly or extended between the one above and the one below. Okay, like I showed you with that Japanese toy. We're going to push this back into space without moving the one above or the one below. And that is chiropractic. If you move more than one segment, that is not chiropractic. That is called manipulation. Chiropractic is not manipulation, so we don't call our adjustment manipulation. If you move more than two vertebral in one thrust, it's not chiropractic. It is, you're a manipulator. Okay, so you must not call yourself a chiropractor. Okay, so that is the international worldwide principle. Okay, everybody knows that, but the people that are cracking. Okay, everybody knows that. The people that are cracking multiple sounds are not doing chiropractic, but they think they're doing chiropractic because it sounds good and the patient feels good. Okay, we're not doing these techniques to make the patient feel good. Okay, we're correcting the subluxation so the patient can self-heal. We're adjusting to restore the function of the nerves. Okay. So the cracking sound is not always necessary. If it makes a crack sound, it should make one single sound. Okay. If it makes multiple sounds, you're moving more segments than one, and that is not working well. That is not a role of a chiropractor. that is a role of a martial arts karate uh, artist. Okay. Okay. So it's slipping posteriorly. Okay. So we're going to find that. For this is the disc degeneration that is slipping posterior. This is the Gonstead theory. And this is not actually slipping posteriorly, but it is extended. Okay. So it is closing this IVF. If it is closing, we have to adjust it so that the facet joint will open, and that is called diversified techniques. Okay. Same subluxation occurring here is much more severe because this spine is slipping posteriorly and it is irritating these nerves and this disc. Okay. So this spine is slipping posteriorly on this disc. We're not going to correct the disc. We're going to push the spine back into space on this um, disc between the one above and the one below. So this is how much you want to adjust. Okay, it's about 2 millimeters at most. So this is national listing, national diversified technique. That means that you want to adjust the facet joints, open the facet joints. So the direction is towards the plane of the facet joint. So mostly it is from P to A and I to S. We're going to adjust it superiorly, cephalad. Okay. So this is the direction we want to adjust for diversified technique. Okay. But for Gonstead, we have to adjust it P to A. This is the direction of Palmer-Gonstead techniques, okay? So this is the plane of the disc, and this is the plane of the facet joint. If it is pushing posteriorly, we have to adjust it in this plane, okay? In a right angle, this way, P to A, without I to S, okay? P to A, to bring it back into space. And as we do that, we have to close the open wedge, okay? So the listing is different, okay? So for Gonstead listing, the first letter will always be P, okay? That means that this one spine, let's say this is T5, is slipping posteriorly between 4 and 6. So T5P. Now we're going to see which side the spinous process is rotated. And the listing is based on the spinous process rotation, okay? And the open wedge is determined on the side that the spinous process is rotated. For diversified technique, it is based on the wait, what happened? Just a minute. Just a minute. Yeah, something happened. Okay. It's a different slide, okay? So if there's a disc degeneration or herniated disc, there will be a protrusion. Okay, so this disc will protrude posteriorly and laterally, and this is disturbing the nerves coming in and out. Okay, it's not actually the disc that is disturbing the nerves; it is the inflammation surrounding the discs that is disturbing the nerves. Okay. So we have to push this nucleus back into space. So this is going to be P to A. As it moves, if there's a herniation or disc degeneration, this spine will slip posteriorly and extend. and there will be a the side bend towards the opposite direction of the protrusion. Okay, so there's swelling on the left side in this picture here. So we have to push this line from P to A as we close this open wedge here by doing the torque. So this is left side, we're going to push it P to A as we do a CCW, counterclockwise torque, to close it, okay, to close the inflammation, okay. If it is diversified, we should open the right side, okay. Okay, so the facet joint closing is on the right side, so we open the right side. But even if there's a disc degeneration, if we try to open the right side, it's going to be I to S. It's not going to close this left side. It's just going to open the right side. So that's not going to fix the left neurological problems. Okay. So you have to determine which side the patient has the neurological problem. If the open wedge side has the neurological problem, we have to use Gonstead techniques. If the nerve entrapment is on the closed side, we use a diversified technique. Okay. So I don't know how many of the Indian chiropractor knows about this actually. Okay. Okay. So you have to know which technique to use and which technique not to use. So you need specific evaluation in order to choose your techniques. Okay. So in Gonstead, subluxation is caused here. The disc this spine is moving posteriorly because there's a disc degeneration here. It's not the facet joint that's the problem. If we try to treat the facet joint problem, we're going to just rotate or side bend. So we're not pushing it anteriorly to bring it back into space. That is not going to fix any problems. It may take away some symptoms, but it's going to come back again, okay? And the function will remain, okay? The functional dysfunction will remain. So this is the subluxation here. It is extended and slipping posteriorly, and this protrusion is jamming this nerves. And these nerves are responsible for the skin, muscles, and the organs as well. If there's a spleen problem, you should see the level of T7, 6, 8. By adjusting the spine, the subluxation, the spleen will heal by itself. If there's a liver problem, maybe it's a T4 or 5, 8 problem. You adjust the subluxation at that level and the liver will self-heal. That is a concept of chiropractic. It is very different from the concept that people think that we're treating the posture. Okay. So in this case, this is, let's say this spine is posterior stiff and it's side bending to left. So there's protrusion on the right side. So we have to close, adjust this one spine PTA as we do a torque CW. Okay. Okay. So these are the techniques we could do using a drop table or a high-low table or a stationary or prone. The specific contact is always a single pisiform contact. Okay, it's not a double hand contact you see on YouTube. Okay, so people that are trained to do butterfly techniques, okay, that is not chiropractic. The teacher says that it's chiropractic, but that teacher is not a chiropractor. He's faking because If he's using a butterfly technique, that's not chiropractic, is it? Okay. He makes crack sounds and he thinks it is chiropractic. That's all. So the good thing to determine if your mentor, your teacher, their school is a real chiropractic, trained chiropractic or not, is to see his hands and see his homepage where he graduated, which chiropractic college he graduated from, and see the syllabus that they're teaching at that college. If he's a fake, he won't write it down. He won't write where he was graduated from because he's fake. Okay. Everybody has a responsibility to show where he has been trained as a chiropractor. Okay. So after you graduate, even though you don't have we don't have any registration, official registration, everybody can see our homepage. If you say you're a graduate from Palms Chiropractic College in Japan, they can check our homepage website and see my our college syllabus or curriculum and my diploma or my bachelor's degree where I was graduated. I always write it down on my profile because I've been trained 5 years to become a chiropractor. Okay. And I'm registered by passing the international standardization exam. Okay. So if you're worried about your degree after you graduate, it's nothing about the degree. It's not about the paper. It's about the college, the education you have taken. Okay. So you can prove that you have enough education because we can prove that we're teaching everything that is necessary to become a chiropractor. Okay. So we will prove anything if you have some kind of issue with somebody telling that you have a fake chiropractic degree. Okay. I can prove it to you to them as well. Okay. I'm here for you guys always. Okay.
Yeah, you want to ask any question, you can ask, and I will send the this lectures record uh, YouTube link to you, all of you, so you can share that to all of the participants who are the missing today's lectures. So it
Okay.
will be helpful for them to join the course. And thank you, Jay sir,
Yeah.
for you this excellent lecture.
Okay.
Sham sir, you want to ask any question, or Dr.
Yes, yes, yes. Hello, hello.
Saleva Kumar, if you want to ask any question, you can ask.
Hello, hello,
Hi.
Yeah.
hello.
Yes. Yes.
I
You
can
can
hear you.
hear me?
Yeah.
Yes.
Okay. Sir, what is the fees and duration of this course?
Yeah.
You have to ask Dr. Abukar.
I will inform you. Don't worry. You have to ask about the college curriculum or anything. You can ask here.
Okay.
Okay. Saleva
Okay.
Kumar, you
Yeah.
want to ask anything?
Oh, hello, sir.
Hi. Hi.
Can you hear me? This is Deva Kumar from Chennai.
Oh, hello. Hello. I can hear you very well.
Nice to hear from you. You gave a very good explanation.
Mhm.
Okay. Actually, I have called all our interested people today morning, or some of them missed due to Sunday busy schedule. We will share this lecture in the group. I will talk to them once again, and I will try to bring them again.
Thank you.
Go.
Thank you.
Yes, sure, sure,
Thank you.
sure. Because they want to know what is right, what is wrong. If they
Yeah,
don't
yeah, yeah.
know,
That's good.
Great.
thank you
Great.
again, sir.
Thank you. Okay.
Yeah.
Oh,
Nice to see you. Yeah.
Okay.
Okay. Thank you, Omkar, for making this possible.
Yeah. Yeah.